Hi, I'm Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. And today I want to talk about the percentage of all COVID-19 confirmed hospitalizations that are occurring among the pediatric population versus the adult population. I've recently seen a lot of attention paid to this proportion and specifically stating that it's been consistent over time. And I heard that kids make up about 1.4 to 1.5% of all COVID 19 hospitalizations. And that was a little bit odd to me. I didn't expect that proportion would stay the same over time. And here's why. This is just the age distribution of people who have been vaccinated on a weekly basis in Florida. And obviously, when we rolled vaccinations out, we started early with healthcare workers. Then we had most of the people for a while who were getting vaccinations were in the 65 and older population. And then, of course, we expanded to other age groups over time. And what that's resulted in right now is we see a very strong correlation between older age and higher vaccination rates to date. In fact, the part of the pediatric population, those 12 to 17 or 12 to 19 years old, they're just at about the lowest end. Only about one in every two has had at least one dose of a COVID-19 vaccine, whereas older age groups have much higher vaccination rates. And of course, kids who are less than 12 years of age cannot be protected through a COVID-19 vaccine. And so, just as we've seen with the rollout of the vaccines, it's resulted in a shift in the age distribution away from older people and towards younger people. And we've even seen COVID-19 deaths reported over time, again, shifting to younger ages. At least in my mind, it begged the question, why wouldn't we also see a shift in the age distribution of hospitalizations such that we see a higher percentage of kids being hospitalized over time? Not because the Delta variant is more severe in children, but because they're less protected on average through vaccination than older age groups. And so I've added a few new visualizations to my dashboard to have a basic understanding of this. So you'll notice my new kind of header on the hospitalizations page includes now some additional information. I did add some stuff unrelated to this talk on ICU, people currently in the ICU, but I've also got these percentages, but I've given two different percentages, and I wanted to get under the hood of this. And then this is the main visualization. So what you can basically see are there are two lines over time. The bottom line is basically the percentage that we've heard a lot about. Among people who are currently hospitalized with confirmed COVID-19, what percentage of those are in the pediatric population? And as of September 4th, today, when I downloaded the data, if we looked at the most recent day's worth of information, kids make up 187 current hospitalized people, and adults make up a little under 14,000. Both of these, thankfully, have been going down recently, and that means that the pediatric population makes up 1.3% of all people currently hospitalized with confirmed COVID-19, or 1 in every 74 hospitalized patients. But what about the upper bar? What's that blue bar? Well, that's actually focused on new COVID-19 admissions, not just people currently sitting in a hospital bed, but new admissions. And if you look at that data, again, in the most recent 7-day window relative to September 4th, pediatric patients had 422 new COVID-19 admissions that were confirmed, and adult patients were over 11,000. And so again, if you just do the simple math, that means that pediatric patients make up 3.5% of all new confirmed COVID-19 admissions, or 1 in every 28. So why this big disparity depending on which of these two metrics I use? So I want to try and briefly explain why kids make up a higher percentage of new admissions than they do of those currently hospitalized. And this is actually pretty age-old in epidemiology. So here's just some basic information. And I just want you to assume that each of the arrows, we've got a study population of 20, right? So there's 20 people in our population, keeping it nice and simple. And in the above example, we have how many people? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 people who develop our disease of interest. So ultimately, half of our population gets this disease. But of course, we don't assess the prevalence of the disease that way. Let's say we administer a national survey at 3 different points in time, and those points in time are denoted by the blue line. If you have a disease that has a short duration, so basically the length of each arrow is the duration of the disease, when we administer this survey the first time, we're only going to pick up one person. The second time, we're only going to pick up one person. And the third time we ask about who actually has this disease, again, we're only going to pick up one person. So at each of these 3 time points, the prevalence of the disease, or the percentage of people who are in our study population, 20, who we actually find currently has the disease in each of these 3 time points will be 5%, or just 1 in 20. But if you have a disease with a long duration, people tend to have it and they don't get cured, they don't die from it. Again, this is the same scenario. 10 out of the 20 people in our population ultimately get the disease. But when we administer these national surveys, because the length of disease is longer, it's longer in duration, we're more likely that when we administer this survey are going to pick up more people who currently have that disease. So the true underlying incidence over time is the same in these 2 examples, but because we have a longer duration, we pick up more people. Hang in there with me, this will make sense in just a second. In the same way, so this is a situation in which we're administering screening. Let's say it's to try and pick up cancerous tumors. And what we try and do with screening is to detect the disease in its preclinical stage, before symptoms are present, right? If we catch it early, we can do something about it. But screening, again, as indicated by these blue lines that are vertical, are more likely to pick up a disease that has a very long preclinical phase, right? And so we actually have something, this is just 2 scenarios where you have a rapidly progressing disease. It doesn't last very long, and let's say it kills people very soon. And then we've got a slowly progressing disease over time. And so this sometimes can cause what we call length bias, where screening picks up a higher proportion of less rapidly fatal cases, making it look as though screening extended survival. But it's only because you're picking up the less severe cases that are slowly progressing and have a long preclinical phase. And again, hang in there with me. Finally, we end up with this scenario. And I think this is maybe what's going on with the proportion of kids in relation to hospitalizations. So this is a silly example, but let's just say the 2 yellow bars here, each yellow horizontal bar represents a different person. There are 36 people in this assessment who have been hospitalized. The 2 that are in yellow are pediatric cases. All of the other ones in white are adult cases. And so this is over a 7-day window. Each of the vertical bars represents a different day. And so the number of total new hospital admissions in the past 7 days, or over the 7-day window, there are 34 adults and 2 pediatric patients. So pediatric patients make up 5.5% of new admissions. But what if we just looked, again, at different snapshots every day at how many people are currently hospitalized with COVID-19? And again, obviously the thing that you should notice is the length of stay in the hospital, or the width of the bar, is much shorter on average for the 2 pediatric patients than for adult patients. Adult patients tend to stay in the hospital a longer period of time. Some of them do stay just as short as the pediatric patients, but most of them stay longer, and some of them stay very long. And so again, when we assess the currently hospitalized, you can see on day 1 when we do the assessment, we find 11 adults, 1 pediatric case. That's 9.1% of all those currently hospitalized are pediatric. But on days 2 and 3, we don't pick up any pediatric cases. On day 4, we pick up a pediatric case, but we got 29 adult cases. And so what happens is, if we look over this 7-day window, among those currently hospitalized, and just add all of this up, you get basically, among the adults, 125 hospitalized days and only 2 among the pediatric patients. And so pediatric patients in this very simplistic example make up only 1.6% of, again, what I'll call the currently hospitalized or of all hospitalized days, but they make up a much higher percentage of new hospital admissions. And so it is expected when we look at this new visualization that kids will make up a higher percentage of new admissions, which is this blue bar, than the percentage of people currently hospitalized, the orange line, because their length of stay tends to be shorter. And so again, it's important to maybe look at both of these to get a good reflection of what's really happening and what percentage of all hospitalizations kids are really making up over time. And you can see that since January 1st of this year, you can see the trend line is slightly increasing. I could have made it so that this y-axis stopped at about 4%, but it would have really been a little exaggerated and misleading as to how much of an increase. Remember, these percentages are really low, so I at least put this at the 10% for the maximum on the y-axis, so I didn't make this graph look misleading. And so clearly, again, let me go back. When we see this, the fact that kids are making up a slightly higher proportion of all hospitalized patients and of all new hospital admissions, it does not mean that the Delta variant is more virulent in kids. It just could be that kids, on average, are less likely to be protected by a COVID-19 vaccine because either they're not in an age range that can be vaccinated yet, or their vaccination rates are lower on average than adult patients. And so we also saw yesterday 2 MMWR reports come out from the CDC. They are imperfect, like many of these studies trying to leverage the available COVID-19 data, but neither of them provide any strong evidence that Delta is more virulent in the pediatric population. And so I want to leave you with a few important parting thoughts for some context on the data. First of all, you can see down at the bottom the black bar. These are age-specific COVID-19 admission rates in the past 7 days, looking at that over time per capita, right? So adjusting for the relative population size of the different age groups, and this is in Florida. And so why I show you this is just to show you the pediatric population is down at the bottom in the black line. I am not trying to trivialize hospitalizations in the pediatric population, but I just want you to know that more recently, we've had about 1 in 9,000 children in our population hospitalized each week with COVID-19. And so again, it's still a relatively rare occurrence for a child to be hospitalized with COVID-19, certainly when you compare to other age groups. But it's also important to note that over time, we have seen increasing numbers of children who are ending up in the hospital because so many more have gotten infected with this Delta variant because of its increased transmissibility. And so both the number of children currently sitting in a hospital bed as well as new admissions has risen quite substantially over time. Hopefully, these recent trends that we've seen in the past week or so are that, just like in the adult population, we're starting to see decreased numbers of cases and decreased numbers of hospitalizations. Finally, I've heard a lot of people pay attention to, myself included, I've certainly mentioned this a number of times, a very good thing about the vaccines is that since January of this year, they have shifted the age distribution of hospitalized patients. This white line is showing you basically where the top of the proportion of people 70 plus who have been hospitalized. So it used to be close to 1 in 2 in January. Now it's closer to 3 in every 10. So again, even though this has occurred, because people ask me, well, if this is happening, we're shifting the age distribution of hospitalized patients to younger age groups. And those younger age groups are less likely to experience severe illness or die. Why are we seeing what's happened with the Delta surge? And so this is an important graph that points out a very important thing about percentages versus absolute numbers. Again, this is in Florida. Confirmed COVID-19 hospital admissions in the past 7-day period, looking at that over time. This is our winter surge. And so all I'm showing you is that for every age group, 50 years of age and older, the higher risk groups for mortality, All of these, even though vaccines have protected a lot of people, because so many more people got infected during the Delta surge, all of the peaks that we recently experienced for hospitalizations were higher for all of these age groups, the highest that we've experienced in the pandemic in terms of the sheer number of people who landed in the hospital. And so, what that has resulted in, this is now a graph of deaths in Florida over time. This is by week. The black line is deaths by date they occurred. The red line is deaths by date they were reported. And so, again, you can see very recently with the data dump that just happened a couple of days ago, we have now hit a 7-day moving average number of deaths that is higher than any other point in the pandemic. You can see that as we draw this line across, it's higher. And in fact, there were 10 consecutive days recently in which the 7-day moving average number of deaths was higher than the summer surge of 2020, our previous peak. And if you look at how closely these two lines, deaths by date they were reported, deaths by date they occurred, how closely they ultimately end up following each other on a weekly basis, then if you look at what's been reported of late and how many deaths have been reported, unless there's something very anomalous about the reporting lag, we would expect that this bar that is now facing down is going to continue increasing even as cases and hospitalizations are going down. Eventually, deaths will also go down, but because there's such a lagged indicator, because we had so many people hospitalized, the number of deaths that we will ultimately see by date of death is going to continue to rise. So those are the main themes I wanted to talk about, address this issue about the percentage of hospitalizations that are among the pediatric population, and just always trying to add some context into the numbers that you're hearing about and that we're trying to report on. Hope everybody's doing well, and I'll talk to you soon.